For our next experiment, we'll be talking about test for phosphates, otherwise known as phosphorus blood test. Phosphate tests are very useful for measuring phosphate levels in people with malnutrition and can also be used to check for a condition called ketoacidosis, which sometimes affect people with diabetes. For this experiment, we'll be needing HNO3, otherwise known as concentrated nitric acid, and ammonium molybdate. So let's get into it.
In this video tutorial, we'll see how to perform phosphorus test. 1 bottle of ammonium molybdate reagent, 1 bottle of phosphorus standard of 5 mg% concentration, and the instructions for use. Apart from this, you may require additional items such as clean and well calibrated pipette of 1000 microliter volume, clean and well calibrated pipette of 10 microliter volume, clean and dry tips of 1000 microliter volume, clean and dry tips of 10 microliter volume, tissue paper, clean and dry tubes to perform the test, patient sample, and timer or stopwatch. Now, according to the procedure, we need to take 3 different tubes, one for blank, one for standard, and one for the test. So now we will add the phosphorus reagent to all the 3 tubes. To do this, take 1 ml of phosphorus reagent without any air bubble and then add it to the first tube, which is previously labeled for the blank. Repeat the same procedure for the second tube, which is previously labeled for the test, and the third tube, which is previously labeled for the standard. Next, we will add the standard. So to do this, we will take 10 microliter of standard without the air bubble and wipe the outside of the tip with a tissue paper, and then add it to the second tube, which is previously labeled for the standard, and mix the components of the tube. Then we will change the tip and we will take 10 microliter of patient sample. Again, wipe the outside of the tip with a tissue paper and then add it to the third tube, which is previously labeled for the test, and mix the components of the tube. And then we will start the incubation of 5 minutes at 37 degrees Celsius. After the incubation is over, we will directly take the tube of the blank and then aspirate the reaction mixture into the flow cell. After a small lag time, the instrument will calculate the absorbance of the blank and give you the instructions to read the standard. So now we will take our second tube, in which we have prepared the standard, and aspirate the reaction mixture into the flow cell or the instrument. Again, after a small lag time, the instrument will give the instructions to rerun the standard, where we will press no, because in this case we have prepared only one tube of standard. So now the instrument has calculated the absorbance of the standard and also calculated the factor. Now the instrument is giving the instructions to read the sample. So we will take our third tube of the test and aspirate the reaction mixture into the flow cell. Again, after a small lag time, the instrument will calculate the absorbance of the sample and also give the result of the sample. Further, you can run more samples in exactly the same way. This is the correct way to perform phosphorus test.
The normal range values for phosphate levels in adults is 2.8 to 4.5 milligrams per deciliter, and for children, it is 4.0 to 7.0 milligrams per deciliter. High levels of phosphate in your blood may indicate too much vitamin D, which is related to diabetic ketoacidosis, which is a life-threatening complication of diabetes. It may also indicate hypoparathyroidism, a condition in which your parathyroid gland doesn't make or release enough parathyroid hormone. This hormone is responsible for the regulation or control of calcium levels in your blood. Low levels of phosphate in the blood may indicate malnutrition, alcoholism, and osteomalacia, which is a condition wherein the bones become soft and deformed due to lack of vitamin D. This condition is called rickets in children. That is all for the test for phosphates. Let us now move on to the next experiment.